Hi guys, happy Tuesday. I hope you've had a fabulous day. The weather here in Tennessee is amazing. I got to get outside a little bit during lunchtime, walk around the clinic parking lot, and I recommend you do the same thing. We all need to be outside. We need some sunshine, we need some fresh air, even though the air here in Tennessee is full of pollen right now. Hey, by the way, if you are full of pollen, remember our March special is going until Monday. So the March special was 4 McBees, which help with immunity, and 4 Vitality booths. The Vitality booth is, remember, it gets you the red light, it gets you the salt therapy, it gets you the extra oxygen, but it's amazing for allergies to really help dry that up. So if you want in on that March special, you have until Monday to purchase that. In April, we're launching another special. I know I'm just having fun with these. It's our first year open as ClearPath, and I want to get a lot out there. So in March, what we're going to be doing is 5 Vitality booth sessions for $50. That's $10 a session. It's amazing, can help get you through the springtime. So if you want in on that one will start on April the 1st, but the March special is in play until the end of the month. Couple more announcements. We have a lot of announcements today. So did the March special. I told you about the April special that's coming. Oh, this one's really fun. April 22nd, it is a Tuesday. We're offering another free health screening. That's what we're doing. So from 12 to 4 here in the clinic, you can get a blood pressure, you can get your blood sugar checked, and you can come get a biometric scale reading. So it gives you your body fat, your muscle mass, your visceral fat. So if you're in the Dixon area, April 22nd from noon to 4, please stop in for a free health screening, no strings attached. We're not going to haggle you and try to make you become our patient. We may give you the information about it, but we really just want people to know their numbers, because when you know your numbers, you have the power to change them. And if you don't know your numbers, you don't have the power to change them. That same day, Tuesday, April 22nd, at the library building here in Dixon, Dr. Barry and I will be doing another free open to the community live Q&A. So we'll be broadcasting on our channels, but Dr. Barry and I will be in person answering questions for anyone that wants to come. That flyer is on our website with the address, not the website, my social media is like my Facebook and Instagram. So check it out. And that one is going to be a great one. Oh, somebody had a question. If we purchase 5 sessions, will we have at least 6 months? Oh yeah, you got a whole year to use them. So whenever you purchase them, you got a year to use them, Paula. So on the Vitality booth, if you want in on that deal, go ahead and purchase it and you've got time to use it. But you can safely use the Vitality booth up to every day. And if I start getting snotty, I'll use it every day. All right, next announcement, Low Carb for Better Health. The tickets are up. The website is up. It's a new website. It's going to show you all the speakers that are on there. It's going to be an amazing year. Remember, the last 2 years, we have sold out at least 2 months before the event. So why don't you go get your tickets now to make sure that you have them. The VIP dinner is going to be bigger and more exciting this year. We've got a meat company coming in and sponsoring that VIP dinner, so we're going to be more protein rich there. We've got a coffee sponsor this year that's going to be giving us coffee. It's just going to be, it's amazing. So check that out at lc4bh.com. That's lc4bh.com. That is for the number, not for the word. Get your ticket now. All right, this last one I have been bursting to tell you guys about for, weeks now. But we're adding a new service to the clinic. So do you have stubborn spots that no matter how much you lose weight, that particular part of the body just leaves you wanting? You're not happy with it. Or have you literally worked your hiney off and now you have this loose skin that just makes you feel gross? You want to wear a tank top without your arms flapping in the wind. You would like to put on that bikini or maybe even just a one piece and feel comfortable in that, but your legs aren't where you want them to be due to loose skin, due to cellulite or stubborn fat areas that just don't go away. We are adding a service for you, and I'm excited about this. I can't wait to use it myself. So it is called the T-Shape 2. There is no downtime. It is pretty much painless. There is several sessions that are involved, but what it does is it helps to burn that stubborn fat, smooth the cellulite, tighten and tone the muscle in the skin. So it has 3 different modalities that it works through. The first modality is radio frequency, and that heats and gets deep into the layers of the skin to really activate that fat and activate the collagen to stimulate and tighten. Then its next modality, I'm going to lose my way. So I always stutter when I say this one, so I'm going to read it very carefully. Low level laser. See, I told you I'd mess it up. Low level laser. So what the low level laser does is it targets and breaks down that stubborn fat and cellulite and smooths it out for you. And then the last one is it uses vacuum suction. So think of cupping. So it cups and it pulls blood flow, increases circulation, which heals and helps to get rid of lymphatic drainage. And it also reduces the site of the cellulite, kind of smooths it out. So if you have some areas of your body that you're just not super stoked about, you've worked, you can't get it rid of, or some parts you've never really loved to start with, or that sagging skin after losing weight, whether you're our current client or you're not our current client, we would love to introduce you to the T-Shape 2. That's going to be coming in about 2 months. But if you want to be some of the first people in on the deals, because the first several months of this, adding this device to our clinic, we're going to have some pretty amazing deals. If you want to be on the first of it, either email us at contact@clearpathmedical.net or give us a call at the clinic and tell Marley, hey, put me on the list for T-Shape 2 and send me the deals when they come in. So if you email us, that's probably going to be the best. Make sure we have your contact information and just tell us that you want in on the T-Shape 2 deals. So I think that is all my announcements for today, but it was some pretty fun announcements. You know, the March special is still in soon. The April special is coming in April 22nd. We've got the huge health screening, and then Dr. Barry and I are doing a live free Q&A. Low carb for better health, get your tickets. And then the T-Shape 2. I can't wait. I have one specific part of my body. I'm not telling you what it is, but I'm zapping that thing over and over again. All right, on with our study for today. It's time to learn. In February, we talked a lot about heart health because it was Heart Health Week, and we did several studies and several presentations showing you how certain things higher correlated with cardiovascular disease, and that was mainly insulin resistance, type 2 diabetes, smoking, metabolic disorder, things like that went along with it. And for several years, I've recommended this test called a coronary artery calcium score for people to assess and to know their risks. So this is a very low dose CT that looks at the heart, looks at the arteries around the heart, and tells you if you have calcified plaque in the arteries. And that is what this study looks into. So this study, it was published in February of 2022 in JAMA, very highly respected journal, and it is titled Association of Coronary Plaque with Low Density Lipoprotein, that's your LDL cholesterol, and the rates of cardiovascular disease events among symptomatic adults. It's a big title, but basically they want to know if there's plaque in people who have symptoms and they correlate it with their LDL. So the current guidelines that are out there, and this is in the UK and in the US, states that if you have an LDL above 190, that you should hands down be treated with a statin regardless, just to reduce your risk of an MI. Now, if you've had a heart attack, that level's much lower, but if you've not had a heart attack and your LDL is above 190, hands down, you should be given a statin according to the guidelines, whether or not I believe in those guidelines. And when you are treated, they want to see your LDL get down below 70. That is the treatment recommendation. Remember, go back and watch those episodes from February that tell you how well does LDL correlate, and is this really and truly what we should be barking up to make sure that we're treating cardiovascular disease correctly. Go back and watch those. There's been several small studies that have looked at LDL and have indicated that it doesn't always track with plaque formation. So plaque is the stuff that's in your arteries that truly causes the heart disease. So there was this one study, and it had 246 participants with LDL patients above 190. So all of these 246 people had LDL above 190. And what they found is that 37% of those people with a super high LDL had a 0 calcium score. So they're just making the point here in this small study that just because you have a high LDL doesn't mean you always have plaque in your arteries. But it was small, so it was tiny. There was this other meta-analysis that was put out, and it looked at 1,176 patients, which is fairly small, but here's the kicker and why it was small. All of these patients had familial hypercholesterolemia. So in these individuals, there is known to be a genetic link to high cholesterol And when I say high cholesterol, we're talking about typically well above 200. These are in 4, 5, 6, even thousands numbers that they have. Well, when they looked at these 1,176 people with FH, so the familial hypercholesterolemia, and only 45%, well, no, I back that up. 45% had a 0 calcium score. So that means, yes, 55% had plaque. They were more likely to have a heart attack, but 45%, 0 score, no plaque in their arteries, and they had astronomical cholesterol levels. So clearly we know that high cholesterol does not always 100% track with heart disease. But the devil's advocate to this is, what about soft plaque? Because soft plaque is something that causes more heart events, and it's not something that you can just see on a CAC, which is looking at hard plaque. That's where this cohort study comes in. So what does cohort study even mean? And what they did is they found a database that was full of information from people, and they tracked it and they pulled information from it. So they didn't do a direct intervention study, but they took a database and took information and did math to it. This one, I believe, was done on the Danish individuals. I thought I highlighted it somewhere here. Yeah, it was done on Danish people. It's a Danish cohort that they pulled from. So what they did is they compared the rate of events, and it looked at it in conjunction with LDL and looked at it in conjunction with plaque in the arteries, and try to see if they could find some associations. Remember, association does not always mean causation, but the higher the association, the more likely it is to be related to the causation. So they looked at 23,000. I'm having a hard time with my numbers, and that's a problem because there's a lot of numbers in today's study. There was 23,143 persons, and they did this from January of 2008 to December of 2017. So they enrolled people for quite a long time. Enrolling meaning they pulled their data out of this database here. The median age was around 58, and it was fairly evenly split between males and females. I think it was like 55% females. Now, these individuals were coming into the hospital with symptoms that could be heart related. When they were there, they underwent a CT angiogram. So it's a CAT scan that is looking at the arteries. Now, the CTA is a CAT scan, but there's no dye used. So it's only looking at hard calcified plaque. And remember, the devil's advocate argument is, what about the soft plaque? Well, the CTA sees both the hard and the soft. So you can clearly see how much plaque is in the artery. It's just a much higher level test that's out there. If the individuals had known coronary artery disease, then they were excluded. So if they came in with symptoms and they already knew they had heart disease, they were taken out. So these were people who did not have known disease coming in with potential symptoms. They had a CAC to evaluate it, and what kind of data can we extrapolate from that? They looked at the plaques, and they were categorized as either non-calcified or calcified, so hard or soft in our basic terms. Then they also did CAC scores on them, and they broke it down into 3 groups. You either could be 0, 1 to 99, or 100 plus. The endpoint they looked for, so they classified their LDL, they classified their CAC, they classified to see if they had plaque or not plaque, and then they wanted to see at the endpoint, so they followed them out for about 5 years afterwards and said, did they have a heart attack, did they have an ischemic stroke, or did they die for any reason? Not specifically cardiovascular, just all-cause death. So they looked at all of those 3 things as an endpoint. When they compiled all of this data, remember we started with 23,143 people. 10,700-ish of those had no plaque in their arteries. So coming in with symptoms, no plaque in their arteries. 12,400-ish of them had plaque in their arteries. When they looked at the CACs of all of these people, or not of these people, of the people who did not, hang on, get my right, I gotta get this right. So they did CACs on these individuals, the 23,143. 53.3% had a CAC of 0. So most of these coming in had no calcified plaque in their arteries. 27.1 had a CAC between 1 and 99, and 19.5% had a CAC above 100. The higher the CAC, generally the higher the risk. So if this was, I don't know what my screen just did. It needs to go back. There. did something. All right. I hit buttons. I got to quit hitting buttons. Back where I'm supposed to be. I'm all over the place today, guys. I think I need to go for a run and get some of my energy out. I may have had too much caffeine or something. So if your score was 0, they looked at those that just had 0. 86% had 0 plaque in their arteries. That's a pretty big finding. So that correlates to and backs up the other data that if you have a 0 CAC score, you're about an 86% chance of being plaque free. 13% with a 0 CAC score had non-calcified plaque, and 5 to 6% did have obstructed. So CAC doesn't 100% catch everybody. That's basically what they were saying. So then they looked at plaque and LDL. So the people that had plaque, what was their LDL? And if you had an LDL less than 77%, 56% had plaque in the arteries. If your LDL was between 77 and 112, 51% had plaque in their arteries. Between 113 and 154, 52% had plaque in the arteries. We bump it up a little bit higher, 155 to 189, 57% had plaque in the arteries. And then if you had an LDL above 190, then they had 64% had plaque in their arteries. So it was about the same across the board. No matter where your LDL was, you still kind of fell into this range of between 52 and 64%. I kind of find it interesting that those with the least amount of LDL and those with the most LDL had the highest rates of numbers with plaque in there. All right, so participants that had no plaque in their arteries, so they found people that had absolutely no plaque in this. If your LDL was above 90, 77% had no plaque in there. So above 190, no plaque. And 86% or those were under 77. The prevalence of the calcified plaque had no clear association with LDL. That's all. All those statistics that we just gave you, all those percentages, really just boils down to that. The prevalence of calcified plaque had no clear association with LDL. The other findings, overall absence of plaque was associated with a low event risk across all the LDL ratings. So if you have LDL cholesterol that is above what your provider wants it to be, and you go have a CAC, you can see that it basically is telling you you're not building plaque, your risk is low. So you're probably in that risk that is not going to need to treat that LDL. The absence of coronary artery calcium was also associated with low event rates across LDL. It wasn't a 0 risk, but it basically, if you get a 0 CAC, regardless of your LDL, you're at low risk. That's what this study backed up. They also found that the atherosclerotic burden was the same across LDL. So just looking at people with LDL low and high, and this was a point I made out when I was talking about with the less than 70 and the above 190 had about the same amount of plaque that's in there. It was seen across the board. It was about the same. So regardless of your LDL, you either had about the same amount of plaque or less amount of plaque. And if you had a low CAC, regardless of your LDL, your risk was going to be low across the board. That's what that said. One number that I want to pick out is when they just looked at the LDL above 190, they found pretty close to what was found in the FH study, that 46% of people had the absence of plaque in the face of having this really high LDL. So the long story of this is short, is their data shows that the absence of plaque and CAC in these middle-aged symptomatic people who you would be thinking have high plaque and high LDL coming in was associated with low overall risk if their CAC score was 0. I'm not giving you direct medical advice here, but what I do think is if you go into your provider and they say, oh my word, you're going to die, you're going to have a heart attack, your LDL's 150, your LDL's 140, your LDL's 150, your LDL's 180, your LDL's 190. Just take a pause and say, okay, I admit that there's a connection with LDL. There is this causal relationship. It does relate to building plaque in the arteries. But I also know that there's other things that make my LDL more likely to build plaque or less likely to build plaque. And I also know from some studies, and you can give them this study, that not everybody with high LDL has plaque in their arteries. So that essentially means that up to 50% of people out there taking a statin for a high LDL have no plaque in their arteries, no disease there to be treated. So suggest you get a CAC score. It's very low dose radiation. It's not going to be painful. There's no needles sticking into you. The worst thing about it is you can't have coffee the morning before. Yeah, that really stinks. But when you get your CAC, if it's 0, then you can say, I have a low risk. My score is 0. I have a low risk. Let's continue to monitor this and see if I'm in the group that really needs to get aggressive with my cholesterol, or if my cholesterol is just fine and I don't need to do anything with it. Now, if you get your CAC score and it's up, does that mean you instantly have to go on medication? No, there's other things you can do lifestyle wise and herbal medicines and things like that. And we've talked about some on this show, but you should have that open and informed discussion with your provider. If your provider does not want to have an open and informed discussion so that you know the risk and the benefits of what your CAC score, your cholesterol score, and the risk and benefits of the medications or supplements that they're willing to prescribe you or tell you to take, then you should come see me, because I will sit down and I will give you the good, the bad, the ugly, the risk, the benefits, so you can make the most informed decision for your health. Because at the end of the day, it's not your provider's responsibility to force you into care or to fear you into care. It is their responsibility to give you the information so that you can make the best informed decision for yourself, because you are responsible for your care and not necessarily your provider, but you have to have the right information to do it with. So I am sorry that I fumbled all over myself with my statistics. I just didn't have my thoughts in the order, but hopefully you got the gist of this study. I did list it in the show notes, so you can go and look at this study yourself, and you can print it off and take it with you to your provider's office. All the studies that I mentioned in the February things about how LDL is not the strongest correlation with heart disease, the studies are there. You can print them off, you can take them and have an informed discussion with your provider, which I encourage you to do. So remember our specials. Maybe that was it. I was just way too excited to get out what was coming to the clinic and how excited I am. And that made me kind of just fumble all over myself today, but next week's a different week. All right, get outside. It's beautiful. Play, have a great springtime, and we will see you next time, guys.